arthritis, bite me. We got something to come after you with. I had my procedure Wednesday, October 16th at 10 o'clock in the morning. And I was out of here by noon and back home. Less than 24 hours later, I was happy. The pain was gone. Oh, my name is Michelle Keeley. I'm 53 years old and suffering from arthritic pain in most joints. And I am a patient here at the Vascular Institute of Michigan. Dr. Margni is the doctor that did my procedure. I went to my regular physician and was talking to her about the pain in my joints, it started, knees, hips, lower back. She at first sent me to Insight for pain management, and that helped. Did some physical therapy. After all that physical therapy and everything, it did as much as it could, and I still do the exercises, but I was still having the pain. So I went back to my doctor, and she had sent me to Vascular Institute of Michigan because of another issue with swelling in my left leg. So I've been being monitored here for over a year. Most recently, a couple weeks ago, I came in for an appointment that was pre-scheduled, and I talked to Karen Wiltz about the pain in my knees and how bad it had gotten. She mentioned this procedure. She said I sound like I'd be a good candidate for it, and asked if I'd be interested, and I was like, I will try anything to get rid of this pain. It is so bad. The pain, especially in my right knee, which gets so sharp and screaming, it would wake me up from a dead sleep in the middle of the night. And then I felt like I couldn't get out of bed, or I was scared to try and put weight on my leg, that I might fall or something. Before this procedure, it was difficult for me to get up and do everything. And doing a lot of walking was very problematic if I didn't have something to lean on. I couldn't even stand in my kitchen sink for more than 2 minutes before the procedure. My pain would be usually around a 6, 7, but at the absolute worst, it would be beyond a 10. It would be like a 12. So she got me scheduled. A week later, I came back in. I was taken back almost immediately and got prepped. It was nice and comfortable. The girls and I were having some laughs. All day, it was just a really good experience. It was very relaxed, very calm. I never felt scared. I was just patiently waiting my turn. Dr. Margni came out in between patients, and he talked to me for just a moment, asked how I was doing and if I was ready for this, and I was like, I'm doing good. Am I ready for this? Yeah, I'm ready. So Dr. Margni did my procedure. He was very kind. He was a really nice guy. After the procedure, I was fine. The girls got me a sandwich and a cup of water, and they got me up and walking around to see how I felt. And just in that little bit, I felt great. I mean, they got me out of bed and I was able to stand, and that pain was already gone. He came and checked on me before I left. He called me the next day, asked me how I was feeling, and I was happy to tell him, I'm kicked back in bed right now, no pain. I'm just relaxing, enjoying my day. And he was happy to hear it. He was glad he could do something that helped me get rid of that screaming pain that just made me feel like I couldn't do anything. Now I can stand at my kitchen sink and do the dishes. It helps. It does what they say it'll do. It takes away that pain and makes it so much easier to get around. So I'm happy. I'm glad somebody's doing something proactive to help people who suffer from osteoarthritis, the knees especially, because how are you getting around if you can't walk? And if this will take away that pain so you can do it, it's a good thing in my book. Now my pain is down to like a 3-4. So things have definitely improved since my procedure. The procedure, for what it does, injecting the little beads into your knee, it does it does block that pain. It stops it completely. I can't believe how much better it feels already. I mean, that day, the next day was even better. I'm happy. This is a great procedure. Anybody who's suffering the knee pain like I was, that's really sharp and wakes you up in the middle of the night, makes it difficult for you to get around, this procedure is your best bet at alleviating that pain and feeling like you can do stuff again. So I endorse it. Here I am from Wednesday, this is Saturday, and I can get out of bed, I can walk all over my house, I can do whatever I need to do, and it's easier. It's definitely improved. So my grandson's even happy. He sees me, he's all, Nana, and giving me hugs, He's like, happy as a lark. I'm up and moving around doing more with him than I was before. I am so grateful that he specializes in a field that can help people with the pain of our osteoarthritis and make it easier for us to get around. I mean, he did a really great job, and I am so grateful for him. So I really just thank you, Dr. Margni.